ColpocleiEasy is a simple LeFort Colpocleisis simulation model for medical learners and patients. LeFort Colpocleisis is an effective and minimally invasive surgical option for women with pelvic organ prolapse who are poor candidates for more extensive surgery and no longer seek to maintain vaginal coital function. ColpocleiEasy may serve as a new way to enhance education and improve understanding of the basic surgical steps of LeFort Colpocleisis by both medical learners and patients. To build this model, you will need the following supplies and equipment.
Using a pencil, trace an interior perimetry of your embroidery hoop in the middle of the fabric sheet. This will serve as a vaginal introitus. Then outline vaginal anatomy around the traced circle. Fold your fabric sheet in half and cut within the periphery of the circle as shown in a diagram. Now take a cardboard and trace an exterior perimetry of the embroidery hoop in the middle of the cardboard. Then cut out a circle using a cardboard knife. Glue the fabric sheet to the cardboard using a glue gun, aligning the two circles together. To assemble a prolapse, take a second fabric sheet and fold it in half. Create a sleeve by stapling along the one short and one long edges of the folded sheet. Now take a shoelace and suture it to the two corners of the stapled short edge of the sleeve via figure of 8 stitches. This will allow for an easier reduction of the prolapse during demonstration. Invert your sleeve. Now we will create different parts of the vaginal epithelium using a third sheet of fabric. Fold the sheet along the long edge and cut it in half. Then take one half and cut it in half again. These will serve as anterior and posterior vaginal epithelium. Take the second piece and cut it in half along the short edge. These will serve as the lateral strips of the vaginal epithelium. Begin attaching the lateral strips of the vaginal epithelium to the lateral edges of your denuded sleeve using 3 Velcro tabs on each side. Repeat this step on the contralateral side of the sleeve. Now attach 3 to 4 Velcro tabs along the midline of the anterior and posterior sides of the denuded sleeve. Now attach 3 to 4 Velcro tabs onto anterior and posterior strips, making sure that they match the Velcro tabs on your denuded sleeve. Fix the proximal open edge of the sleeve onto embroidery hoop, leaving 2 to 3 cm from the lateral strips. Attach additional Velcro tabs to the lateral edges of the vaginal epithelium, matching with the position of the Velcro tabs and the lateral strips. Finally, insert the prolapse into the vaginal introitus. Your model is complete. Now we will demonstrate how ColpocleiEasy can help understand the basic surgical steps of LeFort Colpocleisis. After hydrodissecting the vaginal epithelium, begin by carefully denuding the posterior vaginal epithelium from the fibromuscular layer using sharp and blunt dissection technique. Anterior vaginal epithelium is denuded in a similar fashion. Now place lubricated 12 French thread catheter against the cervix and begin sewing together the cut edges of the anterior and posterior epithelium with a series of interrupted stitches. Continue this process along the lateral strips of the intact vaginal epithelium. Continue by creating the lateral channels around the red robin catheter. Once the lateral channels are created, begin placing first-string sutures or interrupted sutures to plicate the anterior vaginal wall to the posterior vaginal wall. Repeat the previous step until the entire prolapse is reduced. You can use the shoelace in the back of the model to help reduce the prolapse easier. Once the prolapse is reduced, the vaginal epithelium is approximated in a continuous running fashion. Finally, the 12 French catheter is easily pulled through, ensuring channel patency.
We've had great experience using this model to help learners understand the basic surgical steps of LeFort Colpocleisis. We also use this model for patient education and counseling. We hope you enjoy using this model as much as we enjoyed creating it.